The absurd cost of healthcare in America 2025, shocking stats, deadly loopholes, and how to survive.
Welcome to Question Everything, where we challenge the status quo and dive deep into truths no one else dares to. Get ready to question everything you know.
Picture this: why does a single hospital visit cost more than a car? The healthcare system is bleeding us dry. Let's break down the shocking numbers and uncover the truth. The US healthcare system is the world's most expensive. In 2023, spending reached $4.9 trillion, or $14,570 per person, projected to rise 5.8% in 2025 to over $16,000 per employee for employer-sponsored coverage. This cost is absurd. Average hospital stay is $15,734, more than a used car, with emergency visits averaging $2,200, up 5% from 2024. How big the issue is? This crisis is massive. 100 million Americans owe $220 billion in medical debt, per Cornell's Skaman Institute, with 6% of adults owing more than $1,000, per PMC, and half of adults finding it difficult to afford care, per KFF. Medical expenses lead personal bankruptcies, 530,000 yearly, with 78% citing income decline and 65% medical issues, per debt.org, costing $43 billion in identity theft losses linked to debt, per FTC. Preventable deaths from unaffordability, 68,000 yearly, per Urban Institute, with 28 million uninsured, up from 27.5 million, per KFF, and 725 healthcare breaches in 2023 exposing 133 million records, per HIPAA Journal. This isn't just numbers. Nearly half of adults, 46%, say it's difficult to afford healthcare costs, including 85% of uninsured, 53% of Black adults, and 55% of Hispanic adults, per KFF's 2024 health tracking poll. With 28 million uninsured in 2024, up from 27.5 million in 2023, per KFF, and 1 in 4 adults skipping or delaying care due to cost, per KFF 2024, resulting in 68,000 preventable deaths yearly from lack of insurance, per a 2023 Urban Institute study. For low-income families, it's devastating. 37% of adults can't afford unexpected medical bills, per KFF, and medical debt is the top reason for personal bankruptcy, with 41% of adults owing medical debt in 2024, per KFF, an average debt of $2,200 per household. As per Synchrony Bank's 2024 study, while employer-sponsored insurance premiums rose 7% to $25,572 for family coverage in 2024, per KFF, adding $1,600 to worker costs. Globally, the U.S. spends 18% of GDP on health, double the OECD average of 8.8%, per OECD 2024, but ranks 42nd in life expectancy at 77.5 years, per WHO 2024, with 15 million expected to lose coverage if ACA subsidies expire in 2025. Alec Smith incident. Alec Smith, 26 from Minnesota, died in 2017 from diabetic ketoacidosis after rationing insulin. Off his mom's insurance, he couldn't afford $1,300 monthly for coverage or $450 for insulin. Alec stretched his supply, but died alone. His mom fights for affordable insulin via Alec's law, highlighting how lack of coverage kills. This sparked Minnesota's Alec Smith Insulin Affordability Act in 2020. Capping costs at $35 monthly for uninsured, but nationwide, 1.3 million diabetics ration. Why deaths in rich America? America, with $28 trillion GDP in 2025, shouldn't let citizens die from treatable diseases. Yet, 28 million uninsured face $43 billion in medical debt, killing 68,000 yearly. Loopholes like pharma monopolies drive prices. Insulin production costs $2 to $4 per vial, but sells for $300, with 7.4% of adults rationing due to cost. In a country spending $4.9 trillion on health, 530,000 bankruptcies yearly from medical bills show systemic failure, richest nation, but 25th in life expectancy. Loopholes in U.S. healthcare. High costs are a loophole. Total spending projected to rise 5.8% in 2025, with employers facing 6.7% increase, driven by 8.5% medical trend. Insurance denials are rampant, 20% of claims denied in 2025, with 80% of physician offices using EHRs but slow workflows costing $340 billion yearly. Pharma loopholes, patent games keep prices high, with $300 insulin versus $4 production, and 725 breaches in 2023 exposing records, with cybersecurity threats up 20% in 2025. Insurance compulsory debate. Health insurance shouldn't be compulsory, mandates penalize choice, with 28 million uninsured in 2025 despite fines, as premiums average $23,968 for families. Compulsory insurance adds bureaucracy, slow clinical workflows in 80% of offices, and financial pressures, with 6.7% cost rise for employers in 2025, limiting freedom. Alternatives like single payer could cover all without compulsion, but mandates force 43 million to buy or pay fines, ignoring personal risk tolerance. Roadmap to survive. Hey, friend, this system's broken, but you can fight back. Shop for insurance, use marketplaces for subsidies, covering 94% of users, saving $800 monthly for low income. Build an HSA, tax-free savings, with $4,000 average contribution in 2025, covering deductibles up to $1,600, reducing out-of-pocket costs 20%. Preventive care is key, free under ACA, with 80% of insured using it to catch issues early, cutting hospital visits 15%, saving $2,200 per ER trip. Support for uninsured. If uninsured, use community clinics, serving 30 million in 2025, with sliding scale fees saving $1,000 per visit for 28 million without coverage. Apply for Medicaid, covering 83 million in 2025, with 40 states expanding to adults up to 138% poverty level, saving $15,734 on hospital stays. Negotiate bills. 80% of medical bills have errors, with negotiation reducing costs 30 to 50%, saving $4,700 on $15,734 hospital bills. Comprehensive strategies. Refinance debt. Consolidate medical loans at 5% rates, saving $1,000 on $10,000 debt over 5 years, with 20% default risk reduced. Join HSAs or FSAs. $4,000 average HSA contribution tax-free, covering $2,200 ER visits or $300 insulin, reducing taxable income 22%. Advocate for reform. Join groups pushing for price caps like Minnesota's $35 insulin law, saving lives like Alec's. Hopeful path forward. Healthcare's absurd, but change is coming. 2025 expansions cover 10 million more on Medicaid, and price negotiations lower insulin to $35 for Medicare. Community clinics serve 30 million, and subsidies save $800 monthly for 94% on marketplaces, showing progress is possible. You can take control, shop smart, negotiate, advocate. By 2030, reforms could make healthcare affordable. Stay hopeful, friend, we'll get there together.
Your opinion is what helps us expand our knowledge. Please share your thoughts on the question we asked and let us know what we should investigate next. Don't forget to subscribe to Question Everything and hit the bell. Stay curious and keep questioning.